Hi everyone, it's Lauren again, the medical educator here at the DIS Foundation. Thank you for tuning in. Today we're going to go over how to perform CPR on an infant. But before we begin, let's just go over what CPR is again. CPR stands for cardiopulmonary resuscitation, and it's a technique that combines chest compressions and rescue breathing in order to deliver oxygen to the body when a victim is experiencing cardiac arrest. Infant CPR is for infants less than 1 year old, excluding newborns. To perform CPR, you need to do the following steps. First, ensure a safe scene. Assess the victim for responsiveness. Then call 911 and get an AED. Check to see if the victim is breathing normally and if they have a pulse. Perform 30 chest compressions. Deliver 2 rescue breaths. Continue CPR at a ratio of 30 chest compressions to 2 breaths. Use the AED once it's brought to scene, and then continue performing CPR and using the AED until help arrives. So, during your initial assessment of the victim, you want to make sure that the scene is safe, because you don't want to become another victim yourself. Then check the victim for responsiveness by tapping them gently. Basically, you're trying to wake them up as if they were sleeping. And then keep in mind that the victim may have suffered a trauma, so try to be as gentle as possible. Call for help. If someone else is around, tell them to call 911 and get an AED. Otherwise, call 911 yourself on a cell phone if possible. Check for normal breathing. Gasping does not count as normal breathing. So if the infant is not breathing or not breathing normally and someone was around to get an AED, you may begin CPR. If the infant is not breathing and no one is around to call 911 and get an AED and you witness the arrest, you should leave the infant to do so yourself. And if the infant is small enough and you're able, consider bringing the infant with you. If you're alone and did not witness the cardiac arrest, then begin CPR for 2 minutes before going to get an AED. So to perform CPR, begin with chest compressions. If the victim is not already, move them so that they're lying on their back and make sure they're on a firm surface to allow for effective chest compressions. Position 2 fingers in the center of the infant's chest just below the nipple line. You want to deliver 30 chest compressions at a rate of 100 to 120 compressions a minute. And so if you need to, you can sing the song Staying Alive in your head to keep with the right rate. When delivering chest compressions, make sure you're compressing the chest at least 1/3 its depth, which is about 1.5 inches. Allow for complete chest recoil in between compressions, and minimize interruptions in chest compressions. After chest compressions, you want to deliver 2 rescue breaths. To do this, you need to ensure an open airway. You can open the airway by performing the head tilt chin lift maneuver. If you suspect trauma, you should perform a jaw thrust instead to avoid spinal injury. For infants, it is important that you keep the head in a neutral position in order to open it. Suction your mouth around the victim's mouth and nose, and blow for 1 second, looking for chest rise. If there is no chest rise, try repositioning the airway. Deliver 2 breaths. However, spend no longer than 10 seconds before returning to compressions. When giving breaths, barrier devices such as a pocket mask and a bag mask can be used. Rescue breaths are more important in child and infant CPR because children often were experiencing respiratory issues prior to going into cardiac arrest. Don't forget that you can certify online in CPR. You can find a link in the description. We encourage you to become certified as soon as possible, either in a classroom or on your own time with an online course. Thank you for tuning in, and catch up with us in 2 weeks for our next webinar on how to use an AED for children and infants. Please comment below if you have any questions. Thanks, guys. Bye.